So our first guest is the Arthur Lehman Professor of Law at Yale Law School and the founding director of the Arthur Lehman Center for Public Interest Law, Judith Resnik. So please join me in welcoming Judith to the stage.
Hello.
Thank you for joining us.
Hi, and glad to be there. Here, there, wherever we imagine all of ourselves as being as if we were all together.
Yes, Professor, thanks so much. You're very well known nationally and I suppose globally, and certainly locally in the Greater New Haven area, which is a area that we share in common, for your work in prison reform and particularly in litigation. In terms of the broad question that I raised at the beginning, if you look at this COVID period of, let's say, 6-7 months, totally not anticipated, we're not capable of anticipating it, but we find ourselves with it. And here you are, a renowned litigator, bringing cases, moving toward more equity, equality, more humanitarian treatment of inmates. How has COVID impacted on that? You've been doing this for a long time before COVID came around. How has it impacted?
COVID underscores how terrifying confinement is. As I mentioned to you both before we began, Rachel Aviv in The New Yorker had a piece about the Arkansas prisons because there's litigation in Arkansas challenging the conditions of confinement and challenging the fact of confinement because of COVID. And what one sees clearly in her story, as in so much of the litigation, as in your other guests' work as well, is that prisons are awful before COVID, and COVID simply turns it into bright neon, whatever your visual metaphor is, for underscoring that it's bad for people's health and well-being. And so what you saw, the people who are incarcerated have not been sentenced to risk of illness or death, but the fact of COVID takes congregant housing and puts everybody, whether it's a nursing home or a university dorm or a prison or a hospital, if you're too close to other people, we know that is the source of disease spread or the rose garden. And so as we see that, what we understand is you got to keep people in lower numbers. And this goes back, this is why it's really important to think about the role that law could play and law has played in the thing we call prison. There's absolutely nothing natural about taking a human being and changing all their capacity to move freely in the world. It's a whole bunch of decisions. And in 1979, there was a lawsuit challenging the double selling in a pretrial in a jail, in a federal jail in New York. And the US Supreme Court, in an opinion written by then Justice Rehnquist, later Chief Justice, said, it's okay to double sell because it's just for a short time. And in 1981, in an opinion written by Lewis Powell for a 5-person majority, he said, it's okay to double sell for prison because they're really bad people. Without both of those decisions, the state and government, this is the early 80s, before the prison population zoomed to its 1.45 million plus another more than 500,000 in jails. If there had been a price for governments to pay, as in decent, safe, non-congregant, non-double-celled housing, you couldn't have gotten where we are now. So just as law was an engine for this licensing of hyperdensity, law needs to be an engine for refusing to let people stay in harm's way. And the people, by the way, who are in harm's way are staff and communities, as well as the people who are incarcerated. Because the great doctor in Connecticut, Dr. Jamie Meyer, who's been involved in many of these lawsuits as an expert witness, what she taught me was prison health is public health. And the answer is when everybody's sick, the biggest prison's not sealed because staff come in and out. The people inside may be isolated, but the staff, contract workers, physicians come in and out. And so this is a community-wide risk, and the community has to lower the risk. And the only way to lower the risk is to de-densify.